I'm Dr. Smith. I want to start by thanking you for coming in and allowing us to care for you or your family member. I also want to give you a little bit of background information about myself. I'm a board-certified oral maxillofacial surgeon, or otherwise known as a diplomat to the American Board of Oral Maxillofacial Surgeons. What this means is that I have taken and successfully completed multiple vigorous examinations given both verbally and in written form every 10 years. This ensures that I am knowledgeable and proficient in all aspects of oral maxillofacial surgery at a national level. I graduated from University of Michigan Dental School in 1996, and I completed my surgical training at University of California, Los Angeles in 2000. I've been practicing here in Florida for over 20 years. Now, I wanted to start by giving you some basic information about what to expect following any type of surgical procedure. Now, it doesn't matter if it's a procedure on your leg, your arm, your stomach, your face, or even if you cut your skin. Your body's going to respond a certain way and do certain things. So you can expect some things like swelling. Make sure for the face, make sure to put plenty of ice on your face overnight. It's going to help, but it's still going to swell up. You can expect some bleeding. It's mostly going to be saliva, but it'll be red colored for a few days, so don't be surprised by that. You can expect discomfort. I usually give two different types of pain medications. I give a high dose of Motrin, and I give something with a narcotic in it. That way you have a choice. If the narcotic's too strong, just take the Motrin. And during the procedure, I'm going to give you some shots. I'm going to keep you nice and numb for about 4 or 5 hours. Even though you're going to be numb, start taking the pain medication right away. Keep taking it around the clock for the next 2 or 3 days. You'll be comfortable. Don't let it wear off. Take it even if it doesn't hurt for the first few days. You can expect it's going to take a little while for things to calm down, usually somewhere between 7 to 10 days, sometime more, sometime less, depending on how well you heal up, how well you take care of things. There's always a possibility of infection. Depending on what I see, I may give you the pill antibiotics following the procedure, but sometimes even on the pill antibiotics, you can still get infection. May require IV antibiotics in a hospital setting, but usually the pills work out fine. So the usual things you can expect following any type of surgical procedure: swelling, bleeding, discomfort. It's going to take a little while, and possibility of infection. Now, in the head and neck area, particularly working in the mouth, there's a nerve, there's certain anatomy we have to be concerned with. Inside your lower jaw, you have a nerve. This nerve goes through your jawbone itself, and it provides feeling or sensation to areas such as skin in your chin, your lip, gum tissue, teeth, tongue, everything in the lower jaw area. And a lot of times, when taking out a tooth, particularly a wisdom tooth in the lower jaw, the roots of the teeth are close, if not attached to the nerve. So when taking that tooth out, there's always a possibility of damage to that nerve, which can result in you having altered sensations, feelings, tingly feelings, things like that. Now, most of the time, it doesn't happen at all. It can occur, and if it does happen, it's usually only temporary. Temporary meaning can last anywhere from a few months to a few years. Nerves take a long time to heal or regenerate. Sometimes it can even be permanent. Sometimes, because of your own unique anatomy, that nerve could actually be attached to the roots of the teeth. So when you take out the tooth, it can tear the nerve. But most of the time, it doesn't happen at all. If it does happen, people describe it as a numb spot on their chin, their lip, their tongue, and over time it gets smaller and smaller. Time meaning months to years. It's not something that goes away overnight. Something you have to be patient with. Now, inside your upper jaw, thing to be concerned with is your sinus. Your sinus is just basically a big hole inside your upper jaw. And it has a lining or a membrane around it that's very delicate. It's like tissue paper thin. And a lot of times that lining is close, if not associated with the roots of the upper teeth as well. So sometimes when taking out a tooth in the upper jaw, a piece of the lining of the sinus can come out with it. If it does happen, I'll place material in there, place some stitches in, close things up right away. Things usually heal up without any problems. Every now and then the lining may not close all the way or heal properly. You can get a permanent hole or a fistula in that area, which require an additional surgical procedure to attempt to close that. But the usual things to expect: swelling, bleeding, discomfort, and it's going to take a little while. Okay? And this information isn't meant to scare or alarm you. It's just so that you can take care of yourself. You know what to expect. Now, most of the time, people come to see me, an oral surgeon, because they're having something done which is complex and involves a lot of surgery, and they want to go to sleep for the procedure. What's involved with that is I start an IV on you, either in your hand or your arm. I'll give you medications through that. You go to sleep, you do the procedure, you recover for a little while, you go home the same day. It's the same medication that we use in a hospital setting. The only difference is the amount. Because in a hospital setting, I will intubate you or place a little tube down your throat to keep you breathing. Here I don't do that. Here I keep you breathing on your own. So there's a limitation to how much medication I can give to you safely. But the medication is very effective. It's going to put you to sleep, and it's also going to help you forget. So it seems like I start the IV, and next thing you know, you're waking up. At most, you may remember a light in your eye, be talking at one point, but it'll be real hazy. Now, there are certain things required in order to go to sleep. One is you need a fasting period, nothing to eat or drink, including water, for 8 hours before the procedure. You need somebody who's going to be responsible for you, someone who's going to take you home and sign you out, and also your medical history, which I will go over in great detail in a few minutes. I want to thank you for your time, and I'll be right with you.